We are here in Huddersfield. I did drive through Halifax, but I'm assured that we are in Huddersfield, a lovely town in West Yorkshire, where a number of our providers and voluntary sector organisations are based, and I think a number of you around the table live or know the area very well indeed. Huddersfield and surrounding districts have a long history of manufacturing. Huddersfield was also the heart of the Industrial Revolution and the birthplace and the living place of a number of extremely famous people. In fact, 2 prime ministers and a number of creators and other artistic people. So, a very warm welcome to you all, especially observers to the meeting as well. And I recognise that this is a meeting held in public, but not a public meeting. And there's an opportunity shortly for public questions on items on the agenda. Please can we ask that you do not film or take photographs during the meeting due to the need to respect the privacy of those here watching. And we do have a live stream on our website, and we share photos via social media should you wish to view these, and we ensure that the necessary consent is also in place to do this. So I'm going to go around the table and introduce ourselves. I'm Nader Mirza, and I'm the acting chair of the West Yorkshire Integrated Care Board. And on my left...
Hello, my name's Rob Webster. I'm the Chief Executive of the Integrated Care Board.
Hello, I'm Jonathan Webb, Director of Finance and Deputy Chief Executive.
Hello, Ian Holmes, Director of Strategy and Partnerships and Deputy Chief Executive.
Afternoon, I'm Ranshu Chatterjee, Non-Exec Member for the Board and Chair for Finance, Investment, Performance and Transformation Committees.
Thank you. And I'm Lou Auger. I'm the Interim Director for Planning and Performance.
Hello everyone, I'm Melanie Brown, Accountable Officer for Wakefield District.
Afternoon, Vicky Dutchburn, Accountable Officer for Kirklees Place.
Yes, ma'am.
Susie Tilburn, Associate Director of People, deputising for Kate Sims, Director of People.
Hi, I'm Richard Vautry. I'm the Primary Medical Services Representative on the board.
Hi, I'm Keir Shilliker, Programme Director for Mental Health, Learning Disability and Autism, here for Sarah Munro.
Hello, my name is Julie Clennell. I'm the Executive Director of Nursing for the board.
Hello, Lucy Cole. I'm here deputising for Brendan Brown as the Acute Sector Representative.
Hello, I'm Tim Swift. I chair the West Yorkshire Health Partnership Board. I'm a councillor in Calderdale.
Hi, I'm Tim Riley, Accountable Officer for Leeds Place.
Hello, Grace Patton, Accountable Officer for Bradford District and Craven Place and Chief Executive of Bradford District Care Trust.
Hello, I'm Kim Shuttler. I'm the VCSE Sector Lead.
Hello, I'm Shaukat Ali Khan. I'm the Chief Digital and Information Officer for the West Yorkshire ICB.
Hello, I'm Jane Madeley. I'm a non-executive member and chair of the Audit Risk Committee for the ICB.
Hello, my name is Fatima Khan Shah and I'm the West Yorkshire Inclusivity Champion.
Hi, I'm Hannah Davis, Chief Exec from Healthwatch Leeds, and I'm here on behalf of the 6 local Healthwatch working across West Yorkshire.
Hi everyone, I'm Majid Hussain, one of the non-exec members. Good to see you all.
Hi, Amy Willett, Head of Corporate Governance for the ICB.
Hello, I'm Laura Ellis. I'm the Director of Corporate Affairs for the ICB.
I'm going to ask Laura to read out the list of updated apologies for this meeting.
Thank you. We've had apologies from Ed Whiting, Victoria Eaton, James Thomas, Anthony Keeley, Robin Tuddenham, Karen Jackson, Kate Sims and Susie Tilburn is deputising, Sarah Munro and Keir Shilliker is deputising, and Brendan Brown and Lucy Cole is deputising. Thank you.
Thank you. Just in terms of declarations of interest, members, any interests relevant to today's agenda to declare? Okay. Although throughout the meeting, reference will be made to organisational change, and it's recognised that all members of the board should declare an interest, a direct financial interest and a professional interest in this. Thank you. So we now go over to the minutes and action log and matters arising from the meeting of the 16th of December. Can I take these draft minutes as a correct record of the meeting? Yes. I see there are no matters, any matters arising? No? Okay. There are no open items on this meeting? No actions? Okay, thank you. Now we go to the public questions section of our meeting. And as you will know, regular watchers will know that we welcome questions from members of the public about items on our agenda, and we haven't received any questions related to the items on today's agenda. However, we have received a number of questions from members of the public about the federated data platform and the supplier of the technology, Palantir. We've also received a petition in respect of this. And in line with our constitution, we will formally receive the petition at our next board meeting on the 23rd of June. The questions and petition raise concerns, which we take very seriously, and we will review these in the incoming weeks and respond to each of those who have submitted questions in due course. And thank you for those of you who've taken the time to get in touch with us. We have created, and this is a new initiative, a repository of previous public questions and answers on our website, so please take a look if there are any questions that you would like to hear our responses to. And individuals are always welcome to contact the ICB, and there is further information on our website for public inquiries, and the opportunity to submit freedom of information requests or seek assistance through our complaints and PALS services. Thank you very much. So our next item is the Board Assurance Framework, and I'll pass over to Laura Ellis.
Thank you. So I'm sharing today's Board Assurance Framework, or the BAF as we refer to it, as it's the last one in its current format. So it has had a final review, particularly from a place perspective this quarter. But I think what I wanted to sort of bring to your attention really is within the context of the wider organisational change, it is our intention to spend time as a board in April during a development session, really revisiting our strategic objectives, and as the ICB's role changes, focusing on what the principal risks are for us in terms of being able to deliver those. We're also planning to spend time reflecting and restating our risk appetite as a board. So the Board Assurance Framework, the BAF, is an important document, as everybody knows. It is very much intended to try and drive the discussions at the board meeting today, which is why we take it early on the agenda, and it hopefully sets the risk context for the decisions that the board will be asked to make as we work through the meeting. We have mapped potential links for you between agenda items and the principal risks in respect of today's agenda. So really, I think what I'm asking, Nadja, is that we note the review that's been done by places during this final cycle of the year. Note that we are planning to fundamentally review the Board Assurance Framework during our April development session and continue to evolve that over the next few months, and then ask that we make use of it as we're working our way through the meeting in terms of being clear about our risk appetite. Thank you.
Thank you very much. Are there any comments from members? Any questions? AC?
Just briefly, I think I would welcome, as we review the BAF, we had historically certain sort of risks and BAF areas that have been consistently rated really high, and we were not able to move it. Is a meaningful way to perhaps make positive traction within that. So let's take that opportunity in April to review that, please, and see whether we can do something positive about it. Thank you.
Okay.
Yes, thank you, and thanks, Laura, for the paper. I just wanted to also mention to the board that at the recent Audit Risk Committee, there's been a recent internal audit, as we'd had in the previous year as well, about some of our elements of risk management and the Board Assurance Framework within that. It was a good assurance on the audit, and I would just encourage colleagues to look at the sort of further improvements. It was nice that it was recognised in how much we are using the BAF to steer the discussions at board level, but there's some also useful sort of tips in terms of how we could be even more robust in the use of it. I thought the place amendments, accepting it's a high-level review that we've asked them to do in the recent period, but the sort of level of which I'll call that Bradford had kind of identified stuff and put more into their narrative and actions around it, I think is really good examples of how we should move forward and sort of ensure we apply the same rigour in the future. I did have a question, Laura, whether you're able to say anything about once we've reset the BAF in the new organisation, what we're anticipating in terms of our
places and in terms of the place provider partnerships, in terms of with relationship to the West Yorkshire BAF or not? Have we thought that through yet?
Yeah, I'm just looking at place colleagues actually, because I don't know whether they want to describe what some of the planning is around the place provider partnerships and the way that they're approaching risk. They will be closer to that than I am. I don't know, Mel, whether you might be able to come in.
Thank you, Jane. It's still early days in terms of developing what the place provider partnerships risk management system will be that they're using, but of course they will capture their programme risks that are already captured within the work they're doing on neighbourhood health. We are practically looking at options around things that we're going to do around, you know, how we use the providers' systems now, for example, and how we manage declarations of interest. So it is quite possible that people might adopt the host providers' risk management systems, Jane, but some of those conversations are still evolving at place level. So, but we will need to log and keep a record of all of our programme risks and fill that up into the system. We are getting some good advice and support from Laura's team about how to handle that. So it isn't like it's being missed off, but our first meetings are in April, and some of the discussions in April for the PPPs about how do we manage this, how do we manage declarations of interest, and how do we manage some of the areas of work that we're taking forward in terms of priorities. I don't know if that's helpful, Jane.
It is really helpful. I'm just conscious that there's a richness of analysis and insight in the BAFs that we already have and that the places are developing, etc. And whilst things will be different, the role of the ICB will be different, and its relationship with the places, it would be, we don't want to lose the thought behind what's there at the moment and the actions and the mitigations, etc. So I guess it's just encouraging that whilst we may interrogate it differently or not even interrogate it, it's important that that remains in the system somewhere. So just to note.
Okay. Rob?
Yeah, thanks, Jane. I think it's a really good, it's a good example of why we need to really have a strategic review of the board assurance framework as we become a different type of organisation. And I think on that element, I would hope that we do two things. So that the first is to continue to get the insight from the places. You know, the proposed structure with its place-facing integrator teams should allow us to have insight from what's going on in each of the places to help inform our board assurance framework as an organisation with our strategic risks as a commissioner. And then the second thing is to say, well, what is the strategic risk then that we've got as an organisation? Well, it is that the infrastructure and the architecture is not geared up to deliver what's required in a way which is more significant than what we have now. I think it's become a different kind of risk. So I think when we do the review, some of the risks will stay and will probably be scored as significantly more risky. If you look at the risk around people want to do us harm in the current context, that is clearly something which we believe will be amplified, and then some new strategic risks will emerge. In the transition period, we need to make sure that those risks are informed by the right kind of intelligence from the places and the core team.
Thank you, Rob. Any other comments? No? Obviously, it's very clear, as has been pointed out, and Laura pointed this out as well, that this is the last risk register or BAF in this current form. And from the questions and interests of members, it's clear also that there will be different types of risks and different levels of risks. So we look forward to that. So we've reviewed the updated board assurance framework, and which was also pointed out now, we do like to bring the board assurance framework as one of the first items of this board meeting so that we can keep in mind some of our risks as we go forward. Okay, so we now go to my report as the chair. I've been involved in a number of pieces of work and meetings, etc. I would also like to point out that my role as acting chair was extended from last December to this April, while NHS England and our board were looking for a new chair. I can now say that we have a substantive chair, Mr. Mark Chamberlain, who will be joining us on the 1st of April. So he will be chairing the board meetings going forward. And I'm sure you will all give him a warm welcome, as warm as you gave me when I first started. It's been an honor and a privilege for me to be part of this board and to be part of the leadership team here. So from the 1st of April, I go back to my substantive role as a non-executive member on the board. So you can see from my report, I've been engaged with a number of regional developments, meeting with leaders in the NHSE and other places to help, I hope, influence decisions, but also to make sure that I highlight issues of concern, interest and developments in West Yorkshire too. I've also been involved in some NHS research areas, including some lunch and learn sessions where I've learned quite a lot about developments and research developments in our area, district and region. Been busy with ICB board, obviously with some of the NHSE planning meetings where Rob Webster and I attended and took part, and he will probably tell you a bit more about those. I've been chairing the transition committee, of which 3 reports were received in our private meeting earlier on. The main issues there really being that we were dealing with were the voluntary redundancy schemes and the staff consultation schemes, which you will then hear a little bit about later on. I'd like to, at that point, to also thank our external advisors to the Transition Committee, who were Bill McCarthy, who will now be our regional chair, and we welcome him. And also thanks to our advisor on equalities, who's also the West Yorkshire Mayor's advisor and inclusivity champion, Fatima Khan Shah. Both of them have ensured that we have kept in mind issues that are relevant and important to our people, our patients, and of course our staff. So from the 1st of April, we officially go into our transition phase as a West Yorkshire ICB. Our board will be much smaller. So I'd also like to thank members of the board who've really created the concept of the West Yorkshire approach with the ICB, and wish them all well. And hopefully many of them will still be part of our partnership and collaborative work. As I said, the new chair will be joining us soon, and we are out for the recruitment selection of 3 non-exec members, because 3 of our current non-exec members' terms of office come up for, complete in April. Our Chief Executive, Rob Webster, is also retiring, as you will know, on the 15th of April. I think that's his last day. We are really indebted to him for helping us co-produce our West Yorkshire approach, where partnership and collaboration is written all the way through. We are really pleased to also announce that Jonathan Webb, who is our Deputy Chief Executive and also our Director of Finance, will be taking up the interim role of Chief Executive Officer as a time when we actually have recruited a substantive Chief Executive Officer. This was also a very rigorous process confirmed by NHS England, so thank you for that. I've been involved with our board development days, and you'll see more information about that in our in my chair's report. And what I do like to do and like to let people know is that both the development days and the board meetings are held at venues around West Yorkshire. So we hope that we are also promoting those particular venues. The last venue we used was Everybody Arts, And it was fantastic to see members of the public using that premises for a number of health-related ways as well. I've been involved with partnership working through the Integrated Care Partnership, and also have supported recruitment to our provider trusts, Leeds in particular this time. In terms of tackling inequalities, I often get requests to go and meet with emerging or long-standing organizations in the voluntary community sector to where they want to bring the board's attention to the work that they're doing and how they are supporting healthcare in West Yorkshire. So I had the privilege of attending the fairly newly formed health hub at Dixon's Academy, and this was a fantastic example of where education and health come together. And it was also partnership work with Bradford District Care Trust's nurses, and some funding from their charity. So the aim there was to improve access to healthcare for school students and families, and this was a really great way of trying to ensure that there was a lot of interest in prevention of poor health and getting people and communities, especially young people, interested in looking after their own health. I was really keen to see that a couple of the issues that were very close to young people's heart was around mental health, their own and their families' mental health, post-COVID, and for a number of other reasons. And they were really keen and happy to have that hub space to discuss their health issues and other personal issues without any screen time being involved or using of their phones in any way. I did take, we've had a number of subsequent meetings to see how the ICB can work more closely with this organization, and what I do try and do is take members of the public involvement team with me, and we have subsequently had a number of meetings to see how we can continue work with this group, but also learn from them in terms of how they see neighborhood health, which is something that we are one of our ambitions going forward. I think the only other thing I have to say now is that it has once again been a privilege to chair this board, and I look forward to being a member of this board going forward. And I just wonder if there are any questions, comments? AC.
Thank you, Nadia, and thanks for that overarching summary. I had sort of a couple of reflections, but before that, again, thanks a lot for your stewardship during this uncertain time. A lot of things changing, expectations sort of reorienting, but we have, with your and Rob's collective leadership alongside with the exec team, delivered plans as expected, and also the system is performing really well. So thank you for your stewardship and leadership. Same extending to Rob as well. Of course, it's been a fulfilling 4 years in terms of working with yourself, and the way you have led a sort of values-driven culture within the organization, building consensus. So thanks a lot for your time, and hopefully we'll be in touch in some way or form across the system. I think within the report, you just touched upon the public involvement as a key piece of work that you're driving. So thanks, Nazira, for doing that. Given the changes that we are going to see over the next 12 months and beyond, it will be useful to bring back something to the board on how we keep public and patient engagement at heart of our interactions and redesign, both in the PPPs but also across the board. So something for us to reflect on over the next 12 months as we change. And finally, of course, we have agreed in the transition committee looking at to sort of continue the transition phase for the next 12 months. It will be useful to reflect on lessons learned and how we approach the transition and what we have lost and what we have taken forward at the end of that process formally, either through, perhaps I'm not sure if that's an internal audit or a sort of self-reflected example commission would be really useful to take look at it 12 months from now. Thank you.
Thank you, AC. In terms of the transition committee's learning, I think that's a very good point, and we will look at that either in one of our development days or at the next transition committee. In terms of the public voice, we have an item at number 18 where Hannah Davis from Health Watch and Paul Hemingway from the ICB will be raising some of those points, and hopefully we'll have a further discussion about how we keep that independent voice at the ICB and how we make sure that we understand public views better. Thank you. Then I have Kim and Fatima.
Thank you, Chair. This is my last meeting as the VCSE partner lead because of some of the changes, so I just wanted to share some reflections and hope for the future, particularly if we've got VCSE colleagues on the call. The board will look different and we won't have a place on the board going forward, but one of the things that I'm most proud of is that we've really led across the country in terms of our approach and working with the VCSE in partnership. And I think a good measure of success of the work is the empty seat principle, and so if I feel confident that colleagues who will carry the work forward in the ICB and in our places will continue to advocate really strongly, knowing that we've worked incredibly hard on this agenda and recognising that going forward the role of the VCSE will be more important than ever. So as part of the transition arrangements, we have been putting things in place, such as strategic commissioning principles for the VCSE, working really positively with the emerging place provider partnerships about what that looks like in terms of a mature relationship, maintaining that really, really important role of the VCSE. And the Power of Communities programme, which is the programme that I've had the privilege to lead for the past 3.5 years, will be continuing in a different form, led by VCSE leaders from our 5 places. So there will be retained a West Yorkshire leadership to continue the work, particularly important during the transition period. So thank you everybody around the table who've really done something quite different from what we see in other areas of the country in terms of in the way that we work with the VCSE, and I'm grateful for the time on the ICB.
Thank you for your leadership as well, Kim. Thank you. Fatima?
Firstly, can I echo that, because I think Kim Shuttler's phenomenal and we're very lucky to have her. So I've always thought of West Yorkshire being a place of the art of the possible. And one of the manifestations of that is you can't be what you can't see. So for me, as a Muslim Asian woman, working for probably the country's first ICB chair that was a Muslim woman, personally felt a great deal, actually. You've been a role model and an inspiration to me personally, and I'm sure to other people in this board. Thank you for your leadership, giving us stability during times of uncertainty, being the North Star, dealing with my very awkward and pokey questions, my ramblings, but more importantly, influencing policy regionally and nationally. We're really lucky to have you. I'm so glad that you're staying, but I think it's really important to acknowledge that this ICB went to places we never went before. We literally changed the face of our board. It's probably one of the most diverse boards this country's ever seen, and irrespective of where we go, we can't lose sight of that. So I just wanted to acknowledge that publicly, because I think you're amazing.
Thank you. That's been very emotional, but I really, really appreciate that. Thank you. Therese.
I can't follow that. It was just in response to your point, AC, about patient and community involvement, and I'm really pleased to say that our final Bradford Place Board on Friday, we had an end-of-year report almost about our listening programme. Listening is something that we've done probably about 3 or 4 years across Bradford and Craven, where we've gone out to communities to talk to them about what's important, to listen and to hear what's important for them. It shaped our healthcare and wellbeing strategy, and we produced a report last week about how we've met communities and how that's really made a difference in terms of the work we've done in Bradford and Craven. And we agreed at the board on Friday that we would carry on that work, and it would be the foundation stone for how we work going forward as strategic commissioners and local commissioners. So just to give you some assurance, it's very important.
Thank you. Thank you all for your contributions there. I'm very moved by this, but we still have a lot of work to do. We're in transition, and we know from items in various committees and meetings before we got to this afternoon, we have a difficult, tricky time ahead. But I think with the West Yorkshire way, with board members, possibly new board members, and partners around the table who will still be there, we will make West Yorkshire a place where excellent healthcare will be provided and our patients and our public will always have a voice. Thank you for that. I now move on to the Chief Executive's report. Rob.
Thanks, Nadra. Thanks, everybody. Hello, my name's Rob. I'm the Chief Exec, and this is my report to the board. You've got a substantial paper report. You've got 2 reports from me in quick succession, so if we can keep issues around org change to the second report, that would be helpful, because there's a significant amount of information in that report. Like others, I'll start by thanking Nadra for her leadership and support. Chair and Chief Exec roles often the 2 most important relationship. It's the most important relationship in the organisation because it really sets the tone for the system. And I don't think you could get a cigarette paper between me and Nadra in terms of the things that we believe in and the way that we want the partnership to succeed for the benefit of local people. Obviously, we're very different people. We bring different complementary skills, and that's absolutely the way it should be. And I think Nadra, without any fuss, has just got on with it. In what could be, we could be in a position where we created lots of drama and tension and distress, and we haven't done that. I think a member of staff said to me just yesterday, thank you for calming everything for us all of the time. And I think Nadra's been a huge part of that. Like others, I'm grateful for all the partners who will no longer be attending the board. I've already talked about Fatima and Kim. There'll be others too, because this board, this organisation is led by a board which tries to represent the population it serves. It's become increasingly like that because we've taken chances and made choices that have made that happen as one of our 10 big ambitions. So we need to lead the way on that, and I'm grateful that we have done, because it's led to a richer and better board, and we believe in diversity as a strength, and the power of diverse thinking, diverse experiences is something that we always bring to the conversation. So in the report itself, you'll see I've talked about the context, I've talked about national developments, I've talked about regional developments and local developments. And there's a few updates to provide, I think. So firstly, you can see that I've started with the international situation and the fact that because of the diverse nature of our communities, that has direct and indirect consequences for people who live here and our staff. And we need to be conscious of that. Since my last report, we've had the disgraceful attacks on ambulances run by a Jewish charity in this country. We've had people taking weapons into mosques. We've had a lot of tension, which makes people frightened. And we've tried, as much as possible, to recognise that and provide support for our staff and into our communities, because it's critical that we do. Anything we can do to improve the confidence and the sense of belonging that people have, we've tried to do. The second update that I wanted to bring really was about the meningitis B. Well, actually, I'll do this one first. So, alongside the international situation, at the time of writing of the report, we hadn't seen any disruption to the supply chain for the NHS, or any sense of any attacks or cyber attacks which might be levied at health institutions or our partners. Unfortunately, there's been a cyber attack on one significant provider to the NHS, and Jonathan's been looking at what the consequences might be for us and what else we're doing about that. So I'm just going to hand over to Jonathan on that one.
Okay, thanks, Rob. So, as Rob said, there was already an issue across the NHS with regard to the supply of bone cement unrelated to the geopolitical instability, so that was already prevalent. Since then, as Rob's articulated, there is clearly a lot of instability nationally, and that included a recent cyber attack on a major medical technology supplier. That is creating some short-term supply issues. There's no evidence currently of any adverse impact on patient care across West Yorkshire, but the position remains under close scrutiny because we do remain vulnerable. That cyber attack has halted global production, and that could create potential shortfall of products within 3 to 4 weeks' time. And the issue around bone cement as I said, is still ongoing, with likely to be another 4 weeks before full production commences. So those are the issues that we know about, but clearly there is a threat of further cyber action, particularly in relation to American-owned technology suppliers. So provider trusts are working to take that immediate precautionary action that you'd expect. That includes looking for alternative options of supply, validating current stock levels and usage patterns, particularly for critical items, and also now participating in national situation reporting. So those processes are ongoing. Trusts are also being asked to review their business continuity arrangements, and that may include mutual aid, working with NHS supply chain, alternative suppliers, and also potentially independent sector partners to maintain access to clinically necessary products where required. So Trust will continue to keep that under review. Clearly, as an ICB, we will work closely with them where required to support.
Thanks, Jonathan. So in terms of the international situation, you can see there have been further developments. In terms of quality and safety, I'm really pleased that AC talked about, are we learning lessons through the org change? You'll see the lessons learned from the pandemic inquiry have been published or started to be published as the inquiry closed. I think it's a reminder for all of us of the extraordinary efforts that were made by people around this table, by people around tables in all of our places, in all of the institutions and in our communities throughout the pandemic, and the ongoing consequences of the pandemic on performance, of which we're still recovering from. 6 years since the initial lockdown, and also the fact that there will be lessons that we need to continue to learn. So those lessons will continue to come out over the next year. In terms of quality and safety also, you'll have seen that, you may remember that we are responsible for health protection and work closely with our UK Health Security Agency colleagues. There's a significant amount of coverage in the media around the issues that we've had around meningitis B elsewhere in the country, and I just wanted to provide a quick update to the board on what we're doing about that. So meningitis B is a potentially serious communicable illness caused by strains of the meningococcal bacteria. Programmes for vaccination exist to protect those at greatest risk against different strains. Not all of the population are protected against all of the strains. So currently there is an outbreak of meningitis B in Kent. That's led to some deaths following infections associated with a university and a nightclub. And there are 20 confirmed cases that Oaks are aware of, with 9 further notifications under investigation. Illness has been severe, and as I said, there have been 2 deaths because of this outbreak. Nationally, Oaks are leading a multi-agency response. That includes identifying contacts, doing the contact tracing, coordinating antibiotic chemo prophylaxis, working with ICBs throughout the country, and as an additional precautionary measure, offering a targeted reactive vaccination programme. There's been a significant amount of communication around this, including around the symptoms and the significance and the impact of meningitis. And that continues to be the case, including asking primary care to provide antibiotics for any eligible contacts who might present outside of UCSA coordinated clinics. No change in the eligibility criteria at the moment for routine Men-B vaccination, although in light of the recent outbreak, the Independent Joint Committee on Vaccination and Immunisation, going back to COVID, the JCBI, you'll remember that, is going to re-examine eligibility nationally to see whether there should be a change in the vaccination eligibility. So our regional team will continue to monitor the situation locally, and we've been in dialogue as the ICB with all of our local authority partners and their public health teams to make sure that this is coordinated. At the moment, all we're being asked to do is to help share comms, make sure that we're set up with our public health teams, our medical director and others, to make sure our understanding of meningococcal disease is clear, that we remain vigilant, and that we continue to support the UK Health Security Agency where requested, in line with all of our pre-existing roles and responsibilities for outbreaks and incidents, which the board will be aware of from previous outbreaks, most recently monkeypox, where we dealt with cases in Leeds. So that's the position at the moment. Obviously, there's a great deal of public concern. As I said, our current ask is to share communications and be vigilant. No more than that, and we'll see what the JCVI say about vaccination. The responsibility for vaccination programmes will transfer to the ICB under the organisational change arrangements in the future. That was important for us to talk about that. Also, since my report was published, you can tell we're operating in fast-moving times. I think we put this online 6 days ago. We've now had the guidance through to us around neighbourhood health models, and we've had guidance through around potential future organisational forms in providers in places to support those neighbourhood models, sometimes leading to integrated health organisations. And both of those bits of guidance directly align and correlate with what we are interested in here, which is really good. So the neighbourhood health guidance talks about local government, the NHS, the third sector, and people who operate in real communities, in real places, coming together to deliver joined-up care, potentially through a contract that supports that in a neighbourhood, potentially in a place where neighbourhoods come together to do more across a bigger footprint, and those places linking into the arrangements that we have as an ICB. So it's important to recognise that, and I think we feel positive and reassured. They come with a suite of targets that we will have to make sure that we're on top of, things that we would want to see as an organisation in the planning round who has asked our neighbourhood models and our neighbourhood health service to reduce demand on non-elective activity for our hospitals. Having those targets that align pretty closely to that, I think, is incredibly helpful. There's a huge amount of other material in my summary report, which is there really to provide context for the conversation at the board. You'll see, for example, the confirmation that Don Rockenden will chair the inquiry into Leeds maternity services. And we and the leadership at Leeds are very open to working incredibly closely with the inquiry to make sure that services are safe and effective for families in Leeds and across West Yorkshire. You'll see that there is reference to the Casey review into adult social care reform, again something that we are very keen to ensure happens. You'll see the references to send reform plans, again something else which has been significant in the news, statement of educational needs and developments, so plans. So those being reformed and us in place is having those plans come together. All of this is nationally important, locally essential work that will need to get done. In terms of my report in the round, what it ends with, I think, is linked to the annual staff survey, which is published, I think, on the day that the report was submitted. So this doesn't include much in terms of what does the staff survey say. Well, it paints a pretty bleak picture in a way, a picture that we wouldn't want to see nationally, with staff feeling burnt out, staff feeling stressed, morale being affected by change, and so on. It also paints a picture of people feeling confident in their line managers, and for us, confident that they get supported to work flexibly and that their well-being is supported. But we need to move on from that, I think, and we need to recognise that in all of the things that we talk about, we're talking about people, because this is a people business. And we might talk about elective recovery, we might talk about the money, we might talk about what we're going to do around organisational form or incentives. Every single one of those conversations is about people. And we should always start with the people. Who is it that we're trying to help and support in communities? What capacity do they have? What potential do they have? And how do we, through our staff, with their potential, their capacity, their resources, how do we make sure that we fulfil the potential of our staff and the people in our communities, because the inequity that people still face is stark. And the progress that we've made recovering from COVID in some elements of the work that we do around cardiovascular disease, early detection of cancer, cardiac health and so on, is still behind where we need to be if we're going to tackle the inequity for people from different racial and ethnic backgrounds, the disparity for people with learning disabilities, the disparity for people with serious mental illness, and the disparity for people who live in deprived communities. So if we keep that focus on people and recognise that everything's about people, I think we've got a chance. And one of the things I'm really proud of is the conversations that I have with the people we work with and the people that we serve. Yesterday, for example, I went to the fellowship programme, our programme that supports people from different backgrounds to be better leaders, but also gives us benefit because they all do projects around things that where we need better insight into how we tackle problems. And they've done some wonderful work. And people talk to me about how the programme had changed their lives, had shaped their leadership, had given them better prospects. That's the work that we've facilitated and created together because we wanted to have a different type of leadership with different types of leaders in it. In the evening, I went to the Adversity, Trauma and Resilience celebration, which I talk about in the paper. So this is our work with the Violence Reduction Unit, saying we're going to be trauma-informed by 2030, where we recognise that the people who use our services are often the fundamental issue that they have is driven by trauma that they've faced. And if we are trauma-informed, we can have a better response to the needs of people. And in the room were survivors of adult sexual abuse, child sexual abuse, domestic violence, and other issues that have driven trauma. And one of the survivors said to me, as he looked around at the 300 people there, all doing brilliant work, nominated for awards, this is great, you know. All of the people here are absolutely brilliant because in my experience in the past, I've worked with people trying to help and they didn't really mean it, but these all mean it, and they want it to be different for people. And it was a joyous celebration of people often leaving this organisation to leave to the people who will be behind in the organisation, in the system, to do exactly what Kim described earlier for the third sector, to continue with a network that's going to drive this forward in the future. It will be different, but the people in it, their understanding of the potential of people and how we create the space for that to happen is what we're here for, and should give us confidence that all of the work, makes me incredibly proud of all the work that we've done in driving forward improvements in outcomes, managing our finances, trying to address inequalities, standing up for equality, diversity, inclusion in the face of people who don't seem to believe in it or understand our legal duties, if you want to go down that route. So I think it's time to pivot in our organisation. I don't use that word very often because it's a bit of management jargon, but I do think there's a pivot moment. There's a point where you, as Yogi Bear says, when you come to a fork in the road, take it. We need to take a fork in the road that says, right, you know, we're coming to a point now where substantial numbers of people are leaving our organisation, but more people are staying. And those people have to do a job in strategic commissioning to deliver improvements in outcomes, address the inequities that people face, mobilise £7 billion worth of investment to get a good economic and social return. And we need to talk to them and we need to drive with them this work forward, because I'm incredibly impressed with the people that we've got. The amount of work that goes on in this organisation, in this system, just to do the org change, never mind everything else, is impossible to understand, to comprehend that it actually gets done, but it gets done because of the people, and we always bring it back to the people. And that's the greatest privilege I would say I've had in this job, is to lead the people and lead with the people in this organisation and in the system. And we really owe it to them as senior leaders to create some hope for the future. So the report's there to give you a bit of context, and the thing that I would leave you with, as this is my last board meeting, is let's not forget about the people, their potential, and if we create the conditions with the right governance, incentives, etc., they'll always go further than we ever thought was possible.
Thank you, Rob, and thank you for that final reminder. It's all about the people, it's all about you, it's all about us. Any questions, thoughts? Richard?
Thank you very much, Rob. I mean, I've had the privilege of working with you in many, many of your different roles, both locally and nationally, over decades, actually. And I've always found you to be an incredibly great person to work with. Sort of your ethics and your morals, sort of your ethos has permeated throughout the organisations that you've worked with, and set real leadership standards for many, many others to follow. So thank you very much for the work you've not only done for the ICB, but in many of the other roles that you've done both locally and nationally as well over many, many years. We're very grateful for that. As you might expect, one question, just on vaccinations. I mean, you rightly highlighted the concern that many of our residents in the area will have around meningitis B, but fortunately, sort of, it's not a major issue, so we've not seen that as general practitioners, particularly at the moment. But I think it's a recognition of the vital importance of vaccination as a whole. And as practices, we're just coming towards the end of the flu vaccination programme at the ICB, and local places, local practices have been working incredibly hard to get as many people vaccinated as possible. And we've probably saved many lives as a result of doing that this year, and we shouldn't forget that. But also we have great disparities within our system around particularly childhood vaccinations, sort of where if we've got an ICB responsibility around vaccinations in this coming year, we need to do our level best to get vaccination rates up as high as possible, because people shouldn't just be worried about meningitis B. They should be worried about measles. They should be worried about other conditions that are quite prevalent and risky in our community that could also cause the deaths of children as a result of not being properly vaccinated. So we need to really double down on trying to focus on that in the coming year.
Thank you. AC?
Thanks, Rob. Thanks for that background and overarching progress that we have made as a summary. I think I've already mentioned, and thanking you for the 4 years of work. You mentioned something at the start. I think we need to coin a term of being calm. So, of course, we'll have a huge loss, as you spoke about people and leadership through your IQ and EQ that you have sort of utilized. But calm quotient may be something that we need to use you as a North Star. That has been very true in my experience as well, being calm through this change. And thanks for bringing people to the center of this conversation as well, because any transformation, as we all have agreed, is people, process, technology, change, whatever. People comes at the heart of it. And you touched upon all the areas that currently we are working as a board to support this transition. And we have had further assurance in the transition committee, but also in the private board in terms of the interventions you're trying to manage and sort of deploy to ensure that the overall culture dip in terms of the organizational culture doesn't take shape, and it's on that pivot and positive direction and support. The one bit that was touched upon in your report, and I think it's fairly important, given that we are losing quite a few touch points across the organization with respect to the partnership working. I think with yourself leaving, also with quite a few other key members of the organization perhaps moving touch points, partnership will play a huge role in the 3 shifts. And I think as a board, we should keep a close eye on how that is evolving over the next 12 months, its maturity and assessment, because that partnership working is fundamentally based on people and relationship, which takes time and takes a lot of social and human capital. So I think we should bring that back to the board in terms of how we are ensuring that through the transition year, we manage the partnership working.
Thank you, AC. We have Majid, Hannah, and then Fatma.
Yeah, thank you, Rob. Your update was anchored in a people first, fairness, equality, inclusion, which isn't easy and takes a huge amount of effort. So much has been achieved and there's been so much learning, and it'll be a tragedy if you lost that in our sort of new iteration. So I think it'd be really, really good in a year or so's time, if you do a formal sort of stock check, I know we've built things into the structure to carry on some of the work, but to actually test out what have we actually managed to continue, and if anything's dropped off, how can we recover that? So I think that's really important that we sort of formally do that stock check in the future. The second point was on the international situation. It is fast-moving, volatile, and unpredictable in terms of supply chain and sort of pharmaceuticals, medicines, etc. Is there a sort of formal review of emergency preparedness, etc., either regionally or nationally, to make sure that the measures we've got in place at the moment continue to be robust and able to deal with these sort of new challenges that we're facing?
I'm going to look at Lou, I think, just for a quick description of the work that we've done around EPRR and the scenarios we've done which link to this potential situation.
EPRR is really structured. There's a sort of command and control. So we're all obviously looking at the briefings that we're getting, but we do meet to sort of discuss what might happen next. We've had some recent practice when there was a supply chain issue with bone cement, which was about packaging. It wasn't about cyber attack. And we will be able to sort of pull the system together, look at how we would move product across the different organisations so we could continue to do urgents and then move back into the elective recovery. And that was done all in combination with region and national. So we've got some really tried and tested, and we exercise for some of these things. We know we've practiced in them, and that's part of the EPRR process, that we should be resilient, that we're anticipating what might happen next. You can never be absolutely sure that you're ready for everything, but we have got sort of the ability to call up the system, and we know how to command and control resources and to sort of the communication. And I think we've had industrial action is a really good practice for some of these things. You know, there's some of these other types of conditions where we have to respond to system issues. So we are constantly dealing with real incidents, even though they might not always hit the press. So I think hopefully that is reassuring that the processes and the structure is in place at all levels.
Thank you. Just to note that we have an item later on the agenda under system performance, specifically about the EPR, and Lou will be taking that. Thank you. And is that it, Majid? Yeah, now Hannah, and then
Thank you. Just repeating what others have said, really, but just to say thank you, Rob. I think the report that you've just given just describes some of the key elements of what West Yorkshire ICB is around creativity, around innovation, around taking risk, around people, around being so values-led and doing what's right for the people of West Yorkshire. And so just a big thank you, and your support that you're giving to us from a Health Watch perspective. You always said to us, we want you to speak truth to power. And not all health and care systems do that, but you've actively encouraged us to play that role, and hopefully we've done that well here at West Yorkshire and in our local place as well. But just echoing what Majid and AC said earlier, we can't lose that as a West Yorkshire ICB and as a place. It's what's needed in a leading health and care system, particularly with all the challenges that we have at the moment. So I would echo that thought about reviewing it in a year to make sure that we haven't lost the essence of what you've brought us, Rob.
I'd love to read an evaluation report into the leadership of Rob Webster. I think we could make some good money out of that. So this is my last meeting, and many people know that one of the reasons that you're all stuck with me is that it's Rob Webster's fault and Ian Holmes's fault. And one of the reasons that I've been really proud to work in this multi-award-winning, nationally trend-setting, policy-changing organisation is because it's led by a leader who tells you that he wants to hear what he needs to know rather than what he wants to hear. And I've experienced that many times with you, Rob, where we've sat in a room and I've had that nausea in my stomach of saying something to you that I'm like, I don't know how he's going to take this. And you've taken it on the chin and you've done something about it. And there are not many people that I've met, and I've worked with a lot of people that would do that. I've also worked with a lot of leaders who have not stood up when we've been alone. So I remember when COVID happened and the anti-Semitism happened, and the anti-Muslim phobia happened, and you were the first to send out a message across this system to say, we stand with you. This is not what West Yorkshire's about. And many people in this organisation have told me they will not forget that, so I'm saying that on their behalf. I also have witnessed you in forums with many influential leaders speaking truth to power and not really caring about your own personal consequences, and I have been impressed by that. I've tried to emulate that, which may explain why my career is so short-lived, but I have tried to emulate that. And I think that you are truly irreplaceable. But I think Jonathan is an incredible successor, and I hope that he tries to emulate your commitment to truth, to people, to always fundamentally doing the right thing, and doing something that has absolutely driven me crazy, which is a fundamental commitment to relationships and giving it time. As someone who wants to get things done yesterday, you've always coached me to invest time and energy in relationships, because that's how systems deliver what we've delivered. So thank you for being the face of one of the most inclusive organisations I've ever worked for, and thank you for being a leader that is always focused on what someone brings rather than what they lack, and I can't wait to see what you do next. And don't change your phone number.
Yes, Rob, don't change your phone number for those of us who have it. Thanks for your report, Rob, and thank you for assuring us around the meningitis B, and for Richard's contribution and Jonathan's contribution around that. And thank you all around the table for your contribution on the Chief Executive's report. I always find Rob's report really sets the scene for what we've done, what we have to do, and what we're going to do. And I think he's done exactly the same today. And given us a number of pointers for our for our transition phase, and then for the new ICB as well. And I hope that many of you around the table will be people we'll be continuing to work with in other ways. But thank you, Rob, and everything you do. Just in terms of your position on inclusivity and anti-racism, what struck me was the day you said to me, look, all this is going on in the world, but it's not your problem to fix it. It's not your problem to speak out. It's people like me who have to do it. And I thought, whoa, that's so true. But I wouldn't have thought of telling him that. Well, thank you, Rob. So we've considered and noted the points you've raised in your report. So thank you for that. We move on to organisational change, which is with you again, Rob.
Yeah, thank you. I'm presenting this for Anthony Keeley, who's been leading the work with support from the executive. And you can see, again, there's a substantial report. I'm not going to go through it in detail, just to update a couple of things and to remind people that the org change is part of a system change, which all needs to make sense if it's going to work together. So there's national, regional, ICB and local place provider changes going on. So just to update on a couple of things, the NHS Confederation and NHS providers have merged as the NHS Alliance and are looking at what the new offer is for integrated care boards in the context of all these changes. And at the moment there are a number of organisations working with the Confed Alliance to try and get that into a good space. You know, at this point we really need support on the policy development, the practical delivery of effective commissioning, and the support for leadership. Another change that was announced last week is that Matt Style, who is the Director General responsible for commissioning development and the legislation underpinning the 10-year plan, is now going to be the second permanent secretary at the Department of Health and Social Care, which I think is a brilliant move for him. And generally a good move, I think, for somebody who genuinely understands system working and the importance of all those elements coming together. In terms of region, we know that the region are gearing up for their consultation on their structures. That's going ahead of the national DHSC, NHS England consultation. We are working closely still to understand the oversight, digital and workforce elements of their functions, as they are the ones that dovetail the most with us and we require work and capacity from. Not all of the things that we need to be answered have been answered yet, but hopefully they will be shortly. And we have a really good relationship with the region, work very closely with them. Showcap, for example, helping to shape, you know, what's needed in providers, what's needed in the region, what would we as a strategic commissioner do. In terms of the ICB, you can see the substantial progress. Our consultation around the changes and the proposed structures has entered a new phase. So we now concluded the first bit of the consultation. We've made some changes to the structures as a result of that consultation, most notably in things like safeguarding. We have opened up a 2-week consultation on changes to the recruitment and selection process, because we have so far approved 268 people to go through voluntary redundancy in the first wave. Not all of them have accepted and not all have signed their agreements yet, and another 55 in voluntary redundancy who have been offered voluntary redundancy. So if you, at the most, we'll get about 300 people taking voluntary redundancy and leaving the organisation. That brings us closer to the final numbers that we'll need, and therefore we believe it's more suitable, and given the degree of feedback we've had, to move to a different type of recruitment and selection process, which will still conclude at the same time as was previously planned, so doesn't materially affect the timescales by which we'll implement the new structures. We still anticipate moving to the new operating model from the 1st of July. AC mentioned partnership earlier, and you see in the report there's some references to the broader partnership. You know, we started this journey not as a statutory body, but as a group of organisations who wanted to create a partnership as partners to do things on their behalf. We'll be moving back to that type of arrangement. The critical thing is, how is that partnership manifesting itself at West Yorkshire? What does it do? How is it manifesting itself in the places? What does it do? And who are the partners? The work that providers and places have done on provider partnerships is really well advanced. Some really brilliant work going on there, which moves beyond the structural questions to what is it we're trying to achieve here then. So looking at Mel's work, building on the work from the National Neighbourhood Health Improvement Programme, taking that learning into how neighbourhoods are developed to reduce demand in the acute sector, and hardwiring that into a partnership arrangement, which will operate in shadow next year and with contracts from the year after. That's the kind of work that's going on in all 5 of our places. Again, a material example of how there is so much work going on and so much progress being made, which hopefully helps drive improvements in performance and outcomes. So the report's there for assurance and to demonstrate the degree of progress that's been made. Incredibly grateful for colleagues for the work that they're doing in leading teams through this. And know that this is a difficult and potentially distressing time for a lot of people. And we continue to act with compassion and empathy for everyone who's affected by the changes.
Thank you, Rob. Any comments, questions? Anyone who wants to come in before AC? Jane? And then AC.
Thank you. Thanks, Nadra. And thanks, Rob, for the paper. Just a couple of areas I wanted to pick up on with it. So I think it's really good to see that the team have responded to some of the feedback in terms of the consultation process and the approach to the matching for roles. I think, any of us who've been through these kind of changes, it is difficult when you're in the midst of that and you're working up against timelines. But I think, back to earlier conversations in terms of being people focused within the organisation as well as our service users, I think that says a lot about us and is evidence of the approach. So I was really appreciative to see that. I also just wanted to ask about when we provided the board assurance statement during January, February time, there were 2 areas that we weren't able to provide assurance on, and we articulated that in the response to NHSE. I wanted just to see if there was any update from that feedback in terms of where we are in terms of those 2 areas that we hadn't at this stage reflected, please.
So I think I was alluding in the summary to some of those areas still, unfortunately. So the work around digital workforce, that interplay of those functions, we're still not quite I think, where we need to be. I think we're much closer on understanding some of the other areas where we need to invest and have created the addenda and other things around those. But Ian, I don't know if there's anything you want to add.
No, it's still unclear, Jane, unfortunately.
Is it unclear in that it feels as if we have to still accommodate that within the envelope that we've got, or is there any? Because obviously that could take a whole lot of reorganising of other elements if that was the case.
Yeah, I mean, we don't think we can respond to delivering a digital and a workforce function within the £19 envelope. It will be, to do these things properly, it's not 2 or 3 people here or there. I think we fed that back to the region consistently. We're continuing to work with the region through a number of channels, including through Showcat, to understand the operating model in those areas. But I think we're in a position, particularly given where we've got to in the consultation, where our model does not include the workforce and digital leadership to, at the scale that would be required to do it properly. I think it's fair to say.
Okay, Shaukat, did you want to come in on that?
Yeah, I think with regards to digital, I think the delivery arm is still under discussion about the clarity on what the centre will look like with regards to structure. Once that part is clear, then the regional structure, a lot of discussions are going on, but of course we are still waiting for the clarity on the structure. And then our current proposed structure within ICB is based on certain assumptions, as Ian mentioned, that the assumptions are that the system level leadership will be done on region or provider level, not the ICB. And ICB future structure will only be focusing on the requirements on the ICB-led expected deliveries. So the overall central and regional delivery models are yet to be defined, and we are working with colleagues in the region to get clarity on that.
Thank you for that, Shaukat. AC?
Thanks, Nadia. I think I was coming on that point as well in terms of digital and workforce. And we know that we have been having this conversation for quite some time. What I was requesting is for the incoming sort of chair board and our interim CEO to work with the new regional chair to come to a resolution as quickly as possible, because I think, and our director as well, because reflecting on some of the conversation we had earlier in the day, thinking around PPPs, and they are trying to activate digital transformation, thinking around sort of the left shifts, which will involve people and the wider workforce strategy. It's fairly important that during that work that's happening, it's not completely disjointed from the top. So if a resolution is not in sight, is there an opportunity to set up some interim opportunities to support the places, the PPPs, so that each of those PPPs are not going in different directions or is not supported during this process. So that's one of the suggestions in terms of moving forward, while we'll hopefully press for a quick resolution. A second very specific point within the paperwork was around sort of business as usual continuity plans. And I think EMT recently reviewed the business continuity plans for all directorates. It will be useful to see a follow-up sort of assurance in terms of, are there any residual risks that is have you picked up through that, and how you are mitigating that effectively through that plans?
Okay. Thanks, AC. Do you want to make any comment on that, Rob, or?
Yeah, I'm sure Jonathan will have a view. So I think we've been crystal clear on what was required in the board assurance framework that we sent back, and in subsequent conversations and meetings that we've had with regional colleagues, and I think they're working incredibly hard to try and get to the right point on this too. I don't think there's a lack of will to get this in the right space. I'm pretty confident that we'll either get real clarity or we'll have a sort of pragmatic and prudent interim arrangement. We just need to work that through in the right way.
Ian, did you want to come in as well, or Jonathan?
Yeah, I mean, just to reiterate the point, really, I mean, the £19 a head was always quite a constraint for us from day one. And I think the change in the policy position hasn't been helpful. And to be frank, hasn't allowed us to accommodate that most recent ask, which came, a few days before we launched the consultation structure. So the position, I'd say, probably is as it is, subject to the fact that there are ongoing conversations, because we don't want a vacuum to emerge, but we expect regional colleagues to step up and fill that. I guess there is something around, and I don't think this is about PPPs necessarily, but more about NHS providers have all got a vested interest in looking at digital solutions across West Yorkshire. So there are fora set up that do that already, and we'd expect and want to encourage that to continue to happen, which doesn't necessarily mean us staffing up a strategic workforce function, but it does say actually there's an expectation as providers you all work together.
Did you want to come in then? John? No? Oh, Ian, sorry, yeah.
I just was going to get Shaukat to remind us of, as he's legging it, just to get Shaukat to remind us of, so some of the work that Shaukat and the team have done around maturity and getting the arrangements and getting people to connect to each other. We always say, don't we, that part of our job is to get the system to connect to more of itself. Is to look at what capacity actually exists out there. And Shaukat, just remind people of what the capacity is in providers and elsewhere around digital.
Yeah, thank you, Rob. I think we are in a really, really strong position at the moment with regards to digital data and technology. We have improved our digital maturity assessment over around 30% more than a year ago. And this is based on the NHS England's digital maturity assessment parameters based on 44 different technical evaluations. And in addition to that, our initiative with regards to digital data and technology literacy program has been very well received, because that is actually catering for the people, by the people concept, where we are engaging not only with the digital data and technology colleagues only, but also the wider community and our citizens about the tools available for them, about the policies with regards to NHS 10-year plans. We are engaging with the NHS colleagues, industry, academia, and international experts to talk about the best practices and then how we can relate to those best practices within our context. So I think we are in a very strong position, because nationally West Yorkshire is seems like a leading in this area. So my really hope and wish is that we will continue this reputation, and then especially we are the epic center for MedTech West Yorkshire in this entire area. So there's a lot of opportunities through collaboration, through partnership, and I think we just need to build what we have and then take this forward. Thank you.
Sorry, Shaukat, I meant also the number of people working in this arena. I think you did an assessment and a stock take across the 10 providers of what the capacity was.
Yeah, we are. If we can see that there's a around 2,600-700 colleagues are working throughout our jurisdiction within digital data and technology, and we are out of those £7 billion within this area. There's around £280 million we are spending within our ICB jurisdiction across all the institutions. So it's a really significant investment, significant expertise around this, and of course the potential for building from where we are and then to the next level is immense. We just need the right delivery models and right people to take this forward.
Okay, thank you very much, and thank you very much, Shaukat, for bringing us up to date on all the work that's going on, and the numbers are really overwhelming. And hopefully in the near future we'll hear a little bit about the impact and benefits for our communities, our population, and the people who work for us. So thank you, and thank you as well, Rob, for the other updates on your report. So now we're going to go to item, sorry?
Sorry. So it was just sort of two reflections. One is, with the use of this new digital development, there's something about the infrastructure for it to be applied inclusively that we need to consider. The second thing is, and I'm sure Shaukat has done a lot of work in this space, but the bias of digital applications, particularly the use of AI, and its inherent bias. So if we are going to apply this, we need to ensure that we develop the capability within that workforce to apply it in an inclusive way, to harness our aspiration to address inequalities. And I suppose my final one is, firstly, my mind is blown with the volume of people involved in this space, but we're going to park that for a moment. How do we manage the expectation of both pace and delivery, particularly in a world now where people are used to using AI and digital solutions, particularly through the app, where they get things yesterday? So I suppose what I'm trying to encourage the board to think about is the application, balancing pace and expectation to deliver inclusive outcomes for everyone.
Yeah. Thank you, Fatima. We'll definitely take that on board. I don't think we can respond to that now, but I think it is a distinct piece of work, and this will come back to the board through our other governance procedures and things. So we move on to item 18, which is the Integrated Board of the Future, people's voice at the heart of decision making, and we've referred to that from the start of this meeting, so it'd be really good to hear what progress has been made on an item that came to our previous meeting about ensuring the people's independent voice comes to the board. And this is going to be kicked off by Paul Hemingway and then Anna Davis. Thank you both.
Thank you, Nadra. And it's really great to be here today to follow up from the conversation we had in December in relation to making sure that patient and people's voice remains at the heart of everything that we do in our future health and care system, and specifically as an ICB in its new role as a strategic commissioner. So the thing that I'd like to start off with by saying is it's really timely that over the last couple of weeks, the Future of Patient Voice, Learning from the Health Watch Model paper was published by the King's Fund. Because actually what's in that paper is a big recollection and a big reflection of what we do in West Yorkshire and the way that we've worked over the last 4 to 5 years and beyond that from a patient and public voice perspective. So regardless of organisational change and regardless of new organisations and structures, the thing that is really, really clear, and that I can vouch for everybody in this room and everybody that works in and supports West Yorkshire, is that the importance of people voice being at the heart of decision making and impacting decision making is of vital importance. So the thing just to kind of really reference at the very start is that the work that the ICB, working with different partners and different sectors, but particularly Health Watch, since December, to really focus on the outcome of the discussion that we had at board in December, has come on leaps and bounds in relation to making sure that the future model is as strong and robust as it can be, to make sure that we really evidence what our patients are telling us and feature that within our decision making at every level, within not just within the ICB, but within the wider health and care system. So I'm not going to dwell too much on the detail of the paper specifically today, but one of the key elements that I'd really like to draw on is the detail that's in the paper relating to a key group which will be kind of the engine room of the new ICB and the health and care system in West Yorkshire, and that's the experience and involvement group. So that group will be made up of lived experience, varying different organisations across West Yorkshire, and essentially it will be the engine room for the strategic commissioning organisation of the ICB, but also for the whole of West Yorkshire. So that group will meet on an 8-weekly basis, and it will be chaired by the non-executive member for Citizens and Future Generations, and that will be the cog that's in the centre of everything that we do as an ICB and across the whole of West Yorkshire. So that, the terms of reference for that group, as in the paper, are being developed and will be available in the next few months as we get ready to transition to a new organisation within a new way of working across the system. So essentially, that experience and involvement group, as I've mentioned, will be made up of Health Watch organisations across West Yorkshire, VCSE sector, local authorities, NHS provider organisations, people with lived experience, People's Voices forums and partnership, and crucially, West Yorkshire Voice. So West Yorkshire Voice, which I talked about in the board meeting in December, is a group that meets on a regular basis and is made up of people with lived experience and is currently hosted by Healthwatch West Yorkshire. That group is moving into the ICB and will continue to be developed and evolved as the system moves on and strengthens its further commitment to patient and public voice. But crucially, that experience and involvement group will have a very direct impact and inform the new 4 ICB committees of the ICB, with a specific reference to the Quality, Safety and Experience Committee and the Finance, Performance and Commissioning Committee. And purposely those two, as well as the other 2 committees, will inform and influence the decisions and the recommendations that those committees make. It will be informed by regular input from people, from patients, and it will include direct what people are saying and what we are hearing from people across West Yorkshire. So essentially, that group will then produce regular reports to influence and inform the work of each of those committees, but more so to make sure that we can evidence, and there's a golden thread directly from what our patients and people are saying and organisations within West Yorkshire, and how that is informing our work as a strategic commissioner, and what that then results in from a delivery perspective, working with our place provider partnerships across the whole of West Yorkshire. So the EIG, as I've said, short for the Experience and Involvement Group, will be that conduit between the decision-making committees and the board, but equally the new teams and functions within the ICB, but crucially, just as importantly, the emerging place provider partnerships across the whole of West Yorkshire, who will be responsible for delivery and oversight of those services across West Yorkshire. So hopefully that reassures the board here today that actually there is a real clear process involved in how we make sure that regardless of a smaller organisation, regardless of a changed system, patient public voice will continue to feature prominently within the discussions and the conversations that we have across West Yorkshire on an ongoing basis. So from a board perspective, one of the things that we'll continue to do and strengthen is about making sure, as I've mentioned already, that patient feedback directly from our local communities in West Yorkshire, working with our partners, is constantly brought to the board. And that decision making is then evidenced by what is robustly challenged by the EIG, robustly challenged by the 4 committees of the ICB, and also in each of the emerging place provider partnerships, because it's really important that we continue to work together and, crucially, continue to hear what our Healthwatch organisations are saying across West Yorkshire and what they're hearing, because that will continue to influence the work that we do as an ICB in the strategic commissioning role, but equally the emerging place provider partnerships across West Yorkshire. So I'm going to pause there. Happy to hand over to Hannah if she's got any additional reflections, but thank you.
Yeah, no, I think I'd just say, not much to add, Paul, thank you. I just, again, I think it's a reflection of our health and care system that this is the second time that we've had this as a board paper, because the first time you say, but we want to know more, we want to make this really real, and I think that's a reflection of our West Yorkshire Integrated Care Board system. I just wanted to reflect just from a Healthwatch perspective. Obviously, the next year is going to be quite important for us as local Healthwatch, and the legislation around the future of Healthwatch is I think we're expecting it week commencing the 14th of July. 14th of April. But there's likely to be quite a lot of opposition to the abolition of independent voice. So we are hopeful that in some form independent voice will remain within health and care systems. And we'll keep you updated about that. But in the meantime, we're really working hard to make sure that people's voices continue to be heard in all the different change NHS planning at the moment. So from neighbourhood health, from provider partnerships, ICBs, regions, all of us are working within our local places around that space. So just really look forward to working with Paul and the team and being part of the EIG, new acronym to work with. But I just wanted to say thank you to my West Yorkshire Health Watch colleagues who their contracts will be coming to an end. Heather as Associate Director and George, who has led the West Yorkshire Voice as well, and Sharon Jeet before that in the role, and Harriet as well, who did the maternity cover. So thank you to those colleagues as well. And look forward to working with you, Nadra, as chair of that, and Jonathan, and Mark. And we did get a bit of inside intel around Mark, and I think he chaired the quality committee in another ICB, so has a strong commitment to ensuring that people's voices are heard, and that quality is really important. So that review in a year's time will be really important to make sure that we are doing what we want it to do, but look forward to working with you in that.
Okay, thank you. We're asked to approve the recommendations in this paper. Is there any questions, any comments before I summarise? Lucy?
Thanks, Nadra, and thanks, Paul. I think the paper does a really good job of kind of explaining how the board and committee assurance will work, and that public voice is played in through that. And I guess this might not be a question for you, it might be one for Ian. Sorry to put you on the spot, Ian. I guess this is real core business of a commissioning organisation, isn't it? And about how this informs commissioning intentions and how public and patient voice informs then the monitoring of outcomes. So I guess what I didn't quite get a sense of is how this builds through that. Is it just the responsibility of that group? Because that feels like quite a big ask. So I guess I'm just interested in how we use that on a real sort of micro basis in order that we're doing exactly what Rob mentioned, which is trying to address the inequalities that we know exist in our communities at the moment.
Yeah, thanks, Lucy. I mean, I think there is a way of framing this against the commissioning cycle. So to understand population need, we need to listen to people and listen to communities and listen to what they're telling us. To develop priorities, we want to work with populations to do that. We'll hopefully get to a point where we can enact that through contracts in a way that reflects patients' experience and how people are feeling about the services that they're receiving. And to evaluate, we need to understand how things have felt for people. So I think there's a way of describing the role of this group and the work that the comms involvement team will do in future that maps against that commissioning cycle. And that is absolutely part of that is the way that we're planning to approach this, Lucy. So if the question is how we plan to approach this in the future, we will absolutely ensure it's aligned to the commissioning cycle.
Okay. Majid, Fatima.
Yeah, thank you. Really pleased to see this paper here and see the work evolving and the establishment of this group, and just sort of building on the point that's been made. Engagement and involvement happens at multiple levels and layers, and it's really important we triangulate and bring things into the mix, like complaints, what are being raised at localities, any reports that have been commissioned and produced, what the voluntary community and faith sectors. We missed the F off the VCS, so we must make sure that we sort of include the faith sector in this work, so that triangulation is really important. And Ian responded to part of my question about making sure that people are, those insights are involved throughout the commissioning cycle, including evaluation. So what we've commissioned, how effective was it actually? What have we learned, and how can we improve going forward? But again, I mean, it's a really good start, and we must revisit this also in a year's time, say this is what our endeavour was, what's actually happened, and how could we improve and do better. The point is, this is a lot happening internally, but how do we go back to communities to say, look, this is what you said, this is what we did, and really make sure that we get into those grassroots, because often when we create groups, it's the professional consultees who turn up, but the real voices are sort of left behind. So we must make sure we have a concentrated effort to get into the hearts of other communities and those grassroots. Thank you.
Okay, thank you for that, Majid. Yes.
So firstly, Hannah, I would like to echo your thanks to the Health Watch colleagues. They have been phenomenal, and in particular George and all the other colleagues that have been working within the ICB, Heather, etc. My question's a bit different, because Paul, you know I'm a big fan of your work. I really think you're incredible, but there's the bit for me about, so what? So, you know, it's really important that we're part of this strategic group and we're able to influence decision making, and that's wonderful. But there are a lot of people who work in this space who want to be part of the solution. So how do we help them be part of the solution? How do we move towards the aspiration behind the 10-year plan, which is to empower people to take ownership of their own healthcare and come in and help us make the best services possible, which I think goes a bit beyond engagement and involvement. So it's not really your fault, but I think there's something about how we weave that in and be quite bold with our aspiration. And then my second part is we need to be really thoughtful that involvement has a hierarchy. So involvement enables people that are of a certain background, a certain class, a certain financial envelope to have free time and come and be part of these conversations. My question, and it's my final meeting, so I can say this now, is what we're doing about the people that can't. You know, that can't afford to take time off work or on 0-hour contract. How do we make sure that they're able to contribute too? And that leads us down a path of remuneration for involvement. Because if you are someone that is sat at a table with someone who's paid to be there, how is that a parity of esteem? How are you an equal partner? So I think this is a really solid start, and I am being consciously challenging, so please take it with the love it's intended. But I do think there's an aspiration for us to do what we've done before in West Yorkshire, which is, you know, saying to someone in a town hall in Dewsbury, come and be part of the solution, and enabling them to do it.
Thanks, Fatima. As usual, you're sort of poking us and reminding us of what we
You're
don't
really
know.
going to miss me, aren't you?
Of course, of course. I think it'd be fair to say, Hannah and Paul, that this is something that I feel that we have been trying to do, trying to find those voices and people who find us hard to reach, and therefore we've been going out to them as well. So make some very good points there, and I think this is just the beginning. And I should imagine there'll be sort of sub-projects and sub-groupings that will be coming out of this first group. Hannah?
Yeah, I suppose I just reflect when we set up, or when we were asked to set up West Yorkshire Voice by Karen Coleman a few years ago. We could have just got 3,000 people with an email address to join a network, and we didn't do that, and that's what other places might have been more intended to do, but we didn't do that. We did exactly what you're saying there, Fatima, which was who are the people that wouldn't have a route into this sort of decision making at the moment, and that's what West Yorkshire Voice is based on. Those groups, those health inclusion groups, those networks of people that wouldn't use these sorts of places to have a voice. So just to assure you, that was the focus of what West Yorkshire Voice. It wasn't a database of 3,000 people on an email list.
Thank you, Chair. It's Melanie Brown, Accountable Officer for Wakefield Place. And the comments from Fatima are really apt, but what Paul has been doing is been working with colleagues who are shaping our place provider partnership arrangement. So from a local perspective, there will be a local voice from Dewsbury because there will be an engagement and involvement group supporting the place provider partnership, and we'll work in harmony to inform and to manage the work of the West Yorkshire IEG group. Abbreviations do catch on, Paul, don't they? So useful to do that. But the other thing I do want to highlight is Hannah and her team have been working with Paul on developing a framework for a neighbourhood level engagement and involvement. So right now we're just describing one layer, but there are other layers underneath it, which is really important for the board to be assured of. I don't want to repeat some of this is evolving, but just for a practical example, in Wakefield we've agreed it can't be the same group that we've had in our public patient involvement group. Those members are really valuable and will be part of the group moving forward, but we've agreed with Healthwatch Wakefield to hold a workshop in April to reach out to those other people that are important to involve in the community. They're not hard to reach. Sometimes we're not accessible to the people in the community, so I don't like using that phrase. It's about us going out into the community and encourage those colleagues to be part of that place provider partnership involvement engagement forum as well.
Okay. I think Mel, well made point, and I think that's why we use the term people who find us hard to reach, so we turn it on its head. I think I want to thank Hannah and Paul and their teams for all the work that's gone on well before I started with the ICB. We can see from around the table this is really close to everybody's heart, and I'm just pondering whether or not we ought to make West Yorkshire Voices a standing item on our board meetings going forward. So a lot more to talk about and think about, and if any of you have any thoughts or ideas about what we've missed or what we should be thinking about, just let Paul know or Hannah know. So thank you both. So now it's a break time. So if you take 10 minutes and come back at